Hirsutism or increased facial hair growth is a common problem with which parents come to us with a lot of concern. The major concern they have is not only about the current issues, the cosmetic problems, but also about the issue about long-term factors, particularly fertility. Every girl with increased hair does not have a hirsutism. In particular, the hair we see in the hands or the legs, which are more like a lanugo hair, which are part of the familial tendency. These are soft. These are not dark or pigmented, they are not curly, they do not signify an increased androgen growth. However, if there are significant growth of hairs which are there in the male area, quote unquote, so if there is a growth in the beard area, in the chin, in the mustache, around the chest area, the abdomen or the back side, that may be a serious indicator that there is excess level of male hormones or androgens, or there is hyperandrogenism. We rate the hair growth using what is known as the Ferryman-Galway score, which scores 9 different sides of the body. The Ferryman-Galway score can be done directly by the child herself by comparing the X-rays and rating the hair growth. There are other cutaneous manifestations of hyperandrogenism, and these include acne or pimples. So particularly if they are painful, if they are big in size, there is a need to worry. Many girls with high androgen levels may have a lot of hair fall, which is characterized by alopecia, and sometimes there could be also nodular painful swellings which are there in the axilla region. This is also a sign of increased androgens and named as hidradenitis suppurativa. Very rapid onset development of hairs along with change in voice or muscularity may be a sign of a serious virilizing disorder, and this would need urgent evaluation for possibility of an adrenal or a ovarian tumor. Hair growth in both boys and girls is regulated via the same hormone, which is testosterone. Testosterone in girls is produced via ovaries as well as another gland near the kidneys, which is the adrenal. This testosterone is converted locally by the enzyme 5-alpha reductase at skin to dihydrotestosterone, which is the active form of testosterone. This acts on the androgen receptor to cause the hair growth. The ovaries have got a large number of oocytes which are present, and few of them, a few score of them, dozens of them start maturating with each cycle, and only one of these, which is the best or the most suited, is selected as what is known as quote unquote a dominant follicle. All follicles produce more androgen in comparison to estrogen. So in any scenario where the dominant follicle is not being formed, there will be multiple small follicles which are there in the ovaries, resulting in an increased production of androgen or testosterone, causing hyperandrogenism. The hair growth is countered via the effect of estrogen. So conditions wherein there is an imbalance between the testosterone and estrogen, there is excessive hair growth. The major causes of hyperandrogenism or increased androgen levels in a girl includes problems in the ovary. The most common cause is the polycystic ovarian syndrome, rarely ovarian tumors or steroidogenic defects, or adrenals, most common being a form of a genetic disorder like congenital adrenal hyperplasia, or rarely adrenal tumors. Many other hormonal problems like thyroid problem or prolactin problem may also cause polycystic ovarian appearance and features of hyperandrogenism. Drugs are also associated with increased hair growth, and one of the important drugs here is valproic acid, which is commonly used in the treatment of epilepsy or fits or seizures. So if any girl is on valproic acid, it's best to meet with the doctor and discuss that this may be the cause of this hair growth or period irregularity, and there might be a need or an indication to switch the medicine into drugs which are safer. The key aspect of evaluation of a girl who presents to us with hirsutism is the confirmation of hirsutism, the delineation of the underlying cause, and the planning of treatment. In girls who have clear-cut evidence of increased androgen levels and hair growth, we do some hormonal workup, and the key workup includes the testosterone levels, the luteinizing hormone LH, the follicle stimulating hormone FSH, prolactin, and thyroid profile. Many of these investigations are time dependent, so LH, FSH and testosterone should ideally be done in the day 2 to 5 of cycles. If a girl doesn't have a cycle, we give them medications to induce the bleeding and then we can do the test at that particular time. If we do the test in the wrong time, there would be difficulties in interpreting because the hormones do change a lot as far as the periods or the menstrual cycle is concerned.